Hi, my name is Kaylee Tyke, and today I'll be talking about coping with stress and burnout in the field of child life. So, some learning objectives today. After this presentation, you should be able to define some terms including burnout, compassion fatigue, and secondary trauma. You'll also be able to identify the signs and symptoms of these. We're going to talk about what elements of child life increase the risk of experiencing burnout, compassion fatigue, and secondary trauma. Understand how to create a more positive work environment, which reduces the likelihood of burnout, compassion fatigue, and secondary trauma. And finally, list a variety of coping mechanisms that aim to reduce the likelihood of experiencing these factors. We'll start with some definitions. Burnout is a response to stressors associated with your job environment. As we know, every workplace has a variety of stressors. Some are more likely to increase the likelihood of burnout than others. Secondary trauma is the response to working with others who experience trauma. This is a form of indirect trauma. These individuals aren't experiencing trauma themselves, but they are hearing about it, and they might even be involved working with the individuals who have experienced trauma. When both burnout and secondary trauma is present, that leads to what is called compassion fatigue. This usually results from work with patients who have been traumatized over a long period of time. This likely won't happen just from working with one or two patients who have experienced trauma, but an individual who sees trauma on a regular basis is more at risk for experiencing compassion fatigue. So some signs and symptoms. Burnout looks like an individual who is exhausted, not quite as productive, a little more cynical, and there might be depersonalization of clients, not working quite as interpersonally with them, not showing as much empathy or care. For secondary trauma, this can present with PTSD-like symptoms. As I mentioned before, it's an indirect form of trauma, but it still presents as very similar symptoms to PTSD, which can include anxiety, nightmares, and avoidance. And signs and symptoms of compassion fatigue is when you can see both signs of burnout and trauma. So what in the child life workplace contributes to these things? First, emotional labor is a huge part of child life work. We are caring for the psychosocial well-being of patients and families, and often might need to suppress our own feelings to serve or care for others. Through procedural support, through just experience in the hospital environment, child life specialists are often witnesses to human suffering. They also are involved in bereavement support and work with patients and families who have experienced or are experiencing trauma. They also might need to report traumatic incidents such as abuse that they encounter when working with patients and families. So just to talk about the prevalence of this, one study looked at how much exposure child life specialists have to trauma. 55% of the respondents said that they have been exposed to trauma within the past 7 days. About 30% have seen trauma within the past month, 8% in the past 6 months, and 7% in the past year, and only 1% responded that they have never been exposed to trauma. So this goes to show the significant prevalence of trauma in the child life workplace, and that there really needs to be stuff in place in order to reduce the effects of experiencing this trauma, such as the burnout, secondary trauma, and the compassion fatigue. So what are some things that child life specialists can do? Child life specialists should engage in self-care, making sure they are doing what they need to do to take care of themselves, taking time for themselves. A study found that debriefing with peers after an emotional experience in the workplace was very helpful to reducing the effects of burnout, secondary trauma, and compassion fatigue. Mindfulness practice, exercise, sleep, and socializing with friends or family have all been shown to help cope with the experiences in the workplace. Of course, coping is different for everyone, and each individual should do what they know works best for them. So how can the workplace affect the experience of burnout and secondary trauma? They should be able to provide employee education on all of these things. If a specialist is well aware of the signs and symptoms and they can identify it in themselves, it is much easier to be able to work with that, cope, and do what needs to be done in order to help themselves feel better and be more prepared to continue their work. It has been found that emotional intelligence training has reduced the effects of burnout and secondary trauma. So this can be something that an organization implements in order to help support their employees. It has also been found to be helpful to use rotating schedules between units. This is because the units that child life specialists are on have different effects on the likelihood of burnout, compassion fatigue, and secondary trauma. For example, a specialist working in the ICU might not experience as much trauma as a specialist working on the general pediatric unit. This has been found to be because of being able to see patients recover. It is less likely in the intensive care unit. And when a specialist can see patients recover, that reduces that trauma that they are working with. So being able to have the experience of the general peds unit and the ICU, being able to alleviate that burden of trauma they are experiencing can be helpful. Workplace support programs should also be put in place. This could include encouragement of debriefing with peers that has been shown to be helpful. You can also set up times to meet as a team just for the purpose of emotional support, meeting with supervisors and having a good supervisory relationship has been helpful if it is a very supportive relationship with your supervisor. So, in summary, there are stressors in the field of child life that contribute to burnout, secondary trauma, and compassion fatigue. This includes the exposure to patients experiencing trauma, seeing the human suffering, and a lot of elements of the hospital environment. And because of what this experience does, employers and managers should be proactive in taking care of this matter. When employees aren't experiencing burnout, it increases job retention. When they feel they are in a positive work environment, they are more productive and will more likely stay in the field for a longer period of time. It's important to educate child life specialists on the signs and symptoms and coping mechanisms so that they are aware and able to take care of themselves. All right, and that is all I have today. Thanks for listening.